Hi, and welcome to Fairview Range Focus. I'm David Houle, Chief Administrative Officer for Fairview Range. And today we're going to talk about emergency care and trauma services, and as May is Trauma Awareness Month. So I have the pleasure of being joined by three individuals from our Fairview Range Emergency Department. Dr. Julie Houle, who is the Medical Director, Kelly Lawson, who is the Directors of Emergency Services, and Jamie Perell, who is a Supervisor of Patient Care Services for Emergency Department. Did I get that right?
You did.
All right, excellent. So thanks for joining me today.
Thanks for having us.
And it's going to be interesting to talk about trauma care in the emergency room and services you provide. So maybe one of you can start and just tell me a little bit about the month of May, as far as that's Trauma Awareness Month. Is that right?
It is, and we define trauma as injuries that are both intentional and unintentional. And we have come to view injuries all as being preventable, even if it's, for example, a motor vehicle accident. And so a lot of trauma can be prevented, and our hopes are to focus efforts along those lines. For example, bicycle helmets, seat belts, awareness of alcohol and drug-related driving accidents, and drowning, for example, in children who, children under 5, for example, compose 25% of drowning deaths worldwide. So there's a disproportionate number of children under 5 that die by drowning. And our hopes would be that raising awareness of trauma would help eliminate a lot of these deaths.
Okay. So is trauma something that is more with adults than children, or more with children than adults? Is there any difference as far as what age that you see that is considered trauma?
That's a great question, because unlike a lot of medical illnesses that focus on certain age groups, trauma affects everyone equally. Although it affects the younger age group, and by that we define ages 15 to 44, it affects that age group disproportionately. Over 50% of trauma deaths are in that particular age group. And that has to do with the kinds of activities that age group is involved in.
Mm-hmm. So is there a most, for our area anyway, is there a most common type of trauma that you see, or cause of trauma?
Motor vehicle crashes.
Okay. I was thinking maybe that was the case, but so that kind of gives a sense for the age population. It's going to be those that are of driving age, obviously, not children. So motor vehicle accidents, is there a time of year that you see more trauma victims from motor vehicle accidents than other times of the year? Is there any difference?
I can kind of speak to that. Yeah. It really varies. In northern Minnesota, we have weather to consider. So anytime we have icy roads, we're going to see more accidents.
Okay.
So I think in this part of the country, in the winter, we're going to see an increase in motor vehicle crashes. And then just in general in the summer, just because we have more tourists that are visiting our area, so more motorists on the roads are going to increase our number of motor vehicle crashes in the area.
Okay. Now I understand the department is a designated trauma center. I'm not sure if I'm using the right terminology. So and you're designated as a level
3.
Level 3. Kelly, could you help us understand what that exactly means?
So the trauma, help me out, Dr. Houle.
The Minnesota Department of Health assigns designations to hospitals throughout the state. And the concept behind that is that trauma care involves what we call the golden hour, in that severe injuries are most effectively treated as soon as possible. And the Department of Health sort of stratifies or lists centers throughout the state in terms of their capacity to care for critically injured. So, for example, a level 1 center, which is the highest level of trauma care, is located primarily in the Twin Cities. We have 2 level 2 centers in Duluth, which is our primary referral center. Fairview Range is a level 3. And that means that we are qualified to care for trauma care through our general surgeon who is available, our radiology department, our emergency department. And so we are a designated center in this region for trauma care.
Okay, and it was a level 3.
A level 3, correct.
Okay, and so how do you maintain that, or how do you achieve that? Is that something that, that you just decide you're a level 3, or is there an accrediting body, or how does that work?
We are designated by the Minnesota Department of Health.
Okay.
It is a very rigorous process and involves what we call process improvement, meaning we look at every single trauma case that comes through the emergency department. We look at how quickly they were able to move in through the department, how quickly they were able to get to the CAT scanner, for example. And so it's not an easy process at all, and rigorously maintained by the Department of Health.
Okay, well, that's really interesting. So it's really an accomplishment to say that we are a designated level 3 trauma center then.
It's a huge accomplishment.
Great,
yes.
great. Now, I know enough to be dangerous here, but I know that you have to have certain physicians or providers on staff to be a level 3. And you mentioned a surgeon. Is there other services that you have to provide, or that you have to have available at all times?
For the primary service is general surgery, because it is the surgeon. Trauma is, we like to call it a surgical disease.
Okay.
So meaning if you were in a motor vehicle accident and you ruptured your spleen and that had to be surgically repaired, that is something that we would do at Fairview Range. We also have 24-hour access to a CT scanner, which enables us to look at internal injuries. It lets us look at head injuries. So the general surgeon, the emergency room physician, we have anesthesiology available 24/7. All of those are important components of a trauma process.
Okay, all right. So how do you know that a patient's coming in that would be considered a trauma patient, or do you know? If an ambulance pulls up to the door, do you just not know really what they're bringing to you until they come in, or how does that work?
We do know. We work very closely with our EMS services,
Okay.
and we get a report from the paramedics or the EMTs at the scene. That's very helpful for us for preparing for a trauma patient. So we ask specific questions.
Okay.
We want to know the mechanism of injury. That's very important for us. That's going to help us determine potentially what some of the injuries could be when they come in. We want to know what injuries they've noted and what their signs and symptoms are, and any treatment that they have provided the patient before they get into the door.
Okay.
And so a lot of times you'll hear overhead a level 2 trauma ETA, or estimated time of arrival, is in 10 minutes. That's because we're having that dialogue with EMS in the field.
Okay.
And we have a specific criteria that if they're going faster than 30 miles an hour, or they weren't wearing a seatbelt, or they were ejected off of a motor ATV, those all, just based on the mechanism of injury, are going to meet criteria to be considered a trauma.
So that changes how you respond then in the emergency
Yes.
department, or who you activate, or?
Correct.
Okay.
Yep, depending if it's a level 1 trauma or a level 2 trauma.
Okay.
There's 2 tiers.
So if you get a call and they're telling you they're bringing in a particular trauma, tell us what happens in the hospital then during that 10 minutes, like if they call and say, we'll be there in 10 minutes, what happens within the department?
So after it's been deemed that this meets our criteria to be considered a trauma, we call it overhead.
Okay.
So it's announced by the operator, and then we have specific departments that respond immediately to the emergency department. That's going to be our lab. It's going to be our diagnostic imaging. Our patient care supervisor comes right down. We get a nurse from ICU. We get another nurse from the medical floor. It depends on if it's a level 1 or a level 2, and as Dr. Houle had mentioned, if it's a level 1 trauma, we're going to get those surgical services to respond immediately as well.
Okay.
So it's kind of all hands on deck. They are the priority in the hospital at that time. And we have everybody get down to the emergency department. We give them a quick update of what's coming in, and then we all have our roles that we play. And it's a very collaborative effort, team approach.
Okay. So while everyone's assembling, then they are just waiting for that patient to come in. And then I'm assuming that when that patient comes in, they're the center of attention. They get the attention of the entire team.
Yes.
Would that be accurate?
Yes.
Okay.
Yep,
So then what happens when the patient comes in? Is there a particular process or procedure that you, as far as providing the care for the trauma patient? How does that work?
We liken it to a NASCAR pit crew, if you can imagine what that looks like. And so
Yeah.
when this entire staff responds, as Kelly was describing, each person has their spot and their duties. There'll be a nurse who is inserting IVs if we need it. We have respiratory therapy who is there applying oxygen to the patient or managing the airway. If it's in a level 1 trauma, which we define as the most serious trauma, the patient may be unconscious and not able to breathe for themselves, in which case we have our anesthesia department assist us. We'll insert an airway to breathe for the patient. If right away it's deemed that this is a critical patient that would exceed our surgical capabilities, and a good example of that would be if it was a patient with a head injury. We do not have a neurosurgeon here at this facility. Our emphasis is on expediting transfer of the patient, and that means we'll be activating air medical. And Fairview Range is very fortunate to have a helicopter based at the Hibbing Airport, and I think most residents of Hibbing have been here to see the helicopter landing at our helipad. And they can be in Duluth within 30 minutes of an accident.
Wow, that's very fast. So the helicopter, you said, is stationed at the Hibbing Chisholm Airport.
Correct.
So they makes it a very short flight then to get to the helipad at the hospital. So I think that's something a lot of people don't realize, how close that helicopter actually is.
The helicopter is Lifelink, and
Okay.
they are wonderful partners for us. The Lifelink aircraft carries a flight paramedic and a flight nurse, as well as a pilot. They are not able to carry family members. There are very tight quarters in an air medical helicopter, which a lot of people don't realize.
Weather always plays a factor in air travel. There's times, no doubt, because of the conditions, foggy or whatever it might be, helicopters can't fly. What then? If a patient has to be transferred, what happens then?
Hibbing is fortunate to have advanced life support ambulances here. So we have paramedics who are able to manage all of these emergencies. They're able to do airway emergencies, shock emergencies. They can start IVs, manage airways. And so it would be ground transportation.
Okay. Kelly, you mentioned wintertime, and you mentioned as far as that motor vehicle accidents tend to be maybe bit more frequent because of road conditions and icy and so forth. What about summertime? Do you typically see more particular kinds of accidents occur in the summertime versus other times?
Anything that involves outdoors,
Okay.
you have that increased risk. So anytime you walk outside the door, as simple as your child jumping on their trampoline, they could fall off the trampoline and sustain a fracture. People are on their all-terrain vehicles a lot more frequently in the summer months. So four-wheelers, even a skateboard, those activities. And then, of course, boating, as well as just swimming. And Dr. Houle had mentioned drowning, diving accidents. Those are all considered traumas. So anything that we do outside in the summertime, everybody's eager to get outside in the summer. So, just knowing what your risk factors are and just having a safety plan for every time that you venture outside.
Okay.
And then as well in the summertime, we're coming up on the 4th of July here, so people are prone to go camping, have campfires, of course, utilize fireworks, so we frequently see injuries in those regards as well.
Okay. Jamie, so as a patient care supervisor, you have some responsibilities regarding staffing, I'm assuming. So can you tell us a little bit, how many staff do you have within the department? And maybe you could kind of give us a sense for, are they all nurses? What kind of nurses?
Yeah, absolutely. So primarily in the emergency department, we're staffed with a medical doctor, and we have a medical doctor on 24 hours a day. And for 12 hours a day, we also have an advanced practice provider. In addition to that, we have up to 5 registered nurses on staff at a time. And in addition to the emergency department, we have the urgent care for more minor injuries as well. That's staffed by 2 advanced practice providers and 2 licensed practical nurses at this time as well.
Okay. There's a lot of people.
It is a lot of people.
Yeah. Okay. Good. you've mentioned a little bit with regards to, I think Dr. Houle, you said something in regards to preventable. Can you describe that a little bit further in regards to, is there, what can we do, I guess, as just the public, the general public, in regards to how do we avoid, getting involved in a traumatic accident? Is there specific things that you can think of that might be good advice for us to hear?
My number one on my wish list as an emergency medicine provider is to avoid drinking and driving.
Okay.
And especially this time of year. As I mentioned, seat belts, bicycle helmets, ATV helmets, snowmobile helmets, and snowmobilers I find tend to be more active about wearing protective gear. I'd like to see motorcycle helmets. I'd like to see motorists more aware of motorcycles, awareness of speed and of unexpected hazards. And I'm thinking of a motorcycle versus deer accident. You know, striking a deer in a car is an inconvenience and it involves a trip to the body shop, but striking a deer on a motorcycle can be fatal. What would be your wish list, Kelly?
I think top of that as well is just using alcohol in moderation when you're out and about. It makes people very vulnerable if they overindulge in alcohol use and drugs. And for Trauma Awareness Month, we talk about the 3 Ds, and that does involve drinking and drugs, and then distracted driving.
Okay.
We're seeing a lot more people on their cell phones, and that's not just in vehicles. I mean, the other day there was somebody rollerblading and they had their cell phone out, and just that constant technology, a feeling that has to be in your hands, that distracts you and puts you a little more vulnerable and at risk for an injury.
Okay. Thank you for bringing that up, because I think that was one of the things that we hear so much about, distracted driving. And I think sometimes you can hear those kinds of things and just assume that, well, that's in big cities or that's someplace else. But in our own emergency department here in Hibbing, do you see accidents that have a direct correlation to distracted occupants or drivers or otherwise?
Yes. Yes, we see an increase primarily in the motor vehicle crashes.
Okay.
And I know that law enforcement takes it very seriously, and they will ask for the patient's cell phone when they come in to ensure that they were not on their mobile device while the accident occurred.
Okay. So what do they do with that device? I mean, what they're asking to see it?
Just do maybe an interrogation of it to see if somebody had been utilizing it at
So
the
they
time
can
of
look
the
at a
accident.
call record or a text
Yes.
records to see if they were on. Okay. So it's not quite as easy as one might think to say, well, no, I wasn't distracted.
Exactly.
If they can look on the phone and say, yes, you were, or you were using your phone at the time. So, okay. That sounds like very good advice.
Yes.
Jamie, you mentioned a little bit about the emergency department and urgent care. And so, and I hate to, the urgent care is such a great asset for the community. It'd be a shame not to touch on that just a bit, if we may. So maybe you could help us understand a little bit about what's the difference between an urgent care center and the emergency department?
Well, essentially it's the acuity of the patients that we see. When the process begins, a patient comes into the emergency urgent care center and they're first seen by a triage nurse. So from there, that nurse will assign what we call an ESI severity index to the patient. So a level 1 would be something that would require interventions for essentially life-saving interventions would be a level 1. Where as we move up the continuum here to a level 5, that would be somebody who didn't require any resources. So really what we're looking for is immediate interventions needed and the amount of resources needed. So anybody assigned an ESI level 4 or 5 would be eligible to be seen in the urgent care department.
Okay. So if someone was coming to the emergency department, they're ill or they have an injury of some sort, do they have to decide, oh, gee, do I need to go to the emergency department or do I need to go to urgent care? Do they have to decide that?
No, the triage nurse will make that decision.
Okay. So they just walk in the door and...
Yep, and they'll have a quick evaluation by the nurse and they'll determine about how many interventions that the patient will require, and that will deem what course you go.
Okay. And tell me what the hours are.
The urgent care is open from 9 a.m. to 10 p.m. 7 days a week, 365 days a year.
So holidays and weekends included?
Absolutely.
Okay. Well, that's a great asset. I've heard lots of great things about urgent care and stuff. However, I do have another question. When you talk about an emergency department and traumas and the fact that if one occurs, that all hands on deck, does that impact wait times? Does that impact the resources that you have available at all? Can you speak to that, Kelly?
Yes, so if we have a trauma that enters through the emergency department, as we had mentioned, that we're going to utilize all of our resources or the majority of our resources. So that might delay other patients' waits as we are getting that patient stabilized, whether they're going to stay or be transferred out. So there may be, if you hear something paged overhead to the emergency department, it's probably a good indication that there might be an extension of your wait time.
So the severity of an injury or the care that's required somewhat dictates whether you're going to be the first in line or have to wait your turn, if you will.
Yes.
So, okay. Well, I know if I was that person that needed that care, I would appreciate people's patience. That's a hard thing, though. But I can imagine that it impacts the wait times and the resources you have available. All right. Well, I think the other thing about urgent care I wanted to ask about had to do with just the types of things that might be seen in urgent care. Is there commonalities or ailments that you could speak to?
Sure. Minor injuries, sprained ankles, potential ear infection, sore throat, cold symptoms, flu-like symptoms are all things that would typically be seen in the urgent care.
Okay. And so I'm assuming you wouldn't typically see an ambulance bringing someone to urgent care.
That would be very uncommon.
Okay. So that's typically going to go to the emergency department and be treated there.
Absolutely.
Okay. And it's also open 365 days a year, 24 hours a day.
Correct.
Yeah. Holidays included.
Yes.
Your favorite thing, I know. So, all right. Well, thank you. Been really interesting talking about trauma care and about the urgent care, and I guess really the connection between the two. And I can really see how what a great resource for our community and for the patients that you serve to know that that's there if we need it. Hopefully we don't, but it's great to know that it's there. So thank you all for joining me today, and thanks for watching Fairview Range Focus. And if you'd like to learn more about services that Fairview Range offers, you can look at our website at range.fairview.org. And thanks for watching, and you can watch for another Fairview Range Focus next month.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.